Yeah, so Juan Valle presented the data of a randomized phase 2 study looking at ramucirumab or merestinib or placebo in combination with cisplatin and gemcitabine in first-line treatment of biliary tract cancers. So this was a randomized phase 2 study that tried to maximize the ability of patients to receive experimental therapy. So there were 2 randomizations, the first to either IV therapy or oral therapy, since ramucirumab is IV and merestinib is oral. Once that randomization was done, there was a 2-to-1 randomization to either the experimental arms or placebo arm. And the placebo arms were actually combined for an analysis so that both of the placebo arms became one group to which merestinib or ramucirumab were compared. The primary endpoint of the study was progression-free survival, and unfortunately the study did not meet the primary endpoint of progression-free survival. In fact, all 3 arms had very similar progression-free survivals of about 6.5 months. In addition, there was no benefit to either merestinib or ramucirumab in overall survival. Survival was approximately between 10 and 14 months depending on the arm, and there was no statistical difference between the 3 arms. The response rates were also about what we would have expected, a little bit more than 30% in the ramucirumab and placebo arm, although the merestinib arm actually had a slightly lower response rate of approximately 19%. So overall, I think it demonstrated that cisplatin and gemcitabine really is the standard of care, and that regimen performs as well as we had seen in earlier studies like the ABCO2 study. But unfortunately, at this stage in the game, in an unselected patient population, utilizing or targeting the VEGF pathway or the c-Met pathway with merestinib or ramucirumab doesn't add extra value to cytotoxic chemotherapy.